Fantastic. Well, I will just jump straight in. For those of you who I haven't met before, my name is Debbie Aitken, and apologies, I just realized my name on Zoom is still my maiden name, so I've got to change that up. I did get married recently, but I am the Regional Training Director for Americas, Europe, Australia, and New Zealand for USANA. I am a nutritional naturopath by trade, and I've worked many years with many customers and many patients trying to support their needs. And I've also worked and lectured in university. I'm a personal trainer and lecturer within personal training and sports science and health science. So I love the world of health and well-being, love all things fitness, and I love to support people in their health journey, and obviously all things in women's health. And so that really leads us onto our topic today. And as you can see, it is a shocking link between aging skin, weak bones, and hidden effects for those who choose to use HRT. Now, I'm sure so many of you wouldn't even expect or think that there's a link between bones and skin, but that's what today is about. We're going to talk about that, correlate the connection, and then talk about options within health and well-being. Nihad, should I keep going? Do you want to translate there, or what would you think?
Sure, I'll just give an introduction. Welcome everyone. So we have Debbie फिर से है हमारे साथ, और आज बहुत ही interesting session है. The shocking link between aging skin, weak bones and hidden effects of HRT. So बहुत से लोगों को शायद ये पता नहीं होगा कि skin and bones में भी एक relation है, एक link है, जो आज Debbie हमारे साथ share करेंगी. Yeah, please carry.
Okay, so let's have a brief overview. Now, as I said, I'm sure many people are a bit uncertain what this link or this axis potentially is. And it's really like a biological way of describing the interconnection between the skin and the skeletal system, and kind of almost the hormone system as well. So the endocrine system, because obviously that's the key component that connects the two. It's really a newer concept in integrative and anti-aging medicine. So people are really, and doctors and specialists are looking into how we are extending this understanding. Because when it comes down to it, as you can see there, we've got the connection, and that connects estrogen, bone mass, and collagen. So we're going to look at that connection, and then how that connects to something called osteoporosis and what that is. And then really what options could be in place to support these components.
Yes. So आज हम basically ये देखेंगे कि क्या exact connection है हमारे hormones, bone mass और collagen जो हमारे skin में होता है. ये बहुत ही recent development है, recent study है, and latest ये देखा गया है. And उसके बाद जब हम ये समझ लेंगे तो उसके बाद हम देखेंगे कि इसका क्या connection है osteoporosis या फिर and जो भी हम इसके solutions हम जो है इसके जो दे सकते हैं वो आज हम समझेंगे.
Perfect. So just a brief recap, and for those of you who are new to joining tonight or today, this morning, apologies, we're tonight in New Zealand, not for you. We're talking about women's health. We're talking about menopause. Sometimes we struggle to talk about where we're at as we get older, and menopause is such an important topic, such a need for discussion to support all of you fabulous women. It's a natural biological transition in a woman's life, and it really marks the end of the reproductive years. So menopause occurs when you've gone for a full cycle, for a full year without a natural cycle, and the phase is often accompanied by hormonal changes within the body, really the decrease of key hormones such as estrogen.
Right. So ये session women के लिए है, because women and menopause जहाँ पे estrogen levels जो हैं वो decline कर जाते हैं, और ये transition phase है, ये बहुत ही natural है, हर women के life में आता है. और ये menopause मतलब है कि एक पूरे साल आपको कोई भी period cycle ना होना. So ये बहुत ही important है discuss करना और उसको समझना.
Okay, so let's move along. So when we're talking skin and bone and the kind of correlation, we want to look at similarities first. And I think this little diagram is perfect because it highlights how similar a skin cell, not that you can see the skin cell when you look on your hand, but a skin cell and a bone cell can actually be, and relevant within as women age. So you see the skin bone hormonal axis actually refers to how it connects the relationship between those, and particularly key sex hormones as such. So things like estrogen, progesterone, testosterone, and maintaining the structural health between the cells. Okay, go. Before I go on.
ओके, तो ये आप जो राइट साइड में पिक्चर देख रहे हैं, ये स्किन और बोन सेल्स है। ये बेसिकली बहुत ही इंटर रिलेटेड है, और स्किन बोन हार्मोन का ये जो एक्सिस है वो बहुत सारे फैक्टर्स पे डिपेंड करता है, और हार्मोन्स के जो रिलेटेड हैं इनसे वो है एस्ट्रोजन, प्रोजेस्टेरॉन, टेस्टोस्टेरॉन, और बहुत सारे फैक्टर्स इन्वॉल्व हैं इस स्किन बोन और हार्मोन एक्सिस में, जो हम अब समझेंगे इसको।
Okay, so if we look at collagen dependency, for instance, so you've got skin and bone, skin and your bone, your skeletal system, both rely heavily on collagen, okay, for structure, for integrity. So collagen is essentially the framework, like the foundational structure that not only firms and supports your skin, but also your skeletal system as well. So it's the framework, it's a matrix, it's like the scaffolding of your skin cells and of your skeleton. So that's the similarity.
यस, सो कोलाजन जो है दोनों के लिए ही, स्किन और बोन्स के लिए बहुत ही इम्पोर्टेंट स्ट्रक्चर प्रोवाइडिंग मतलब कोलाजन है, जो स्किन को भी स्ट्रक्चर देता है, फ्रेमवर्क देता है, और सिमिलरली बोन को भी स्ट्रक्चर देता है, फ्रेमवर्क देता है। सो ये दोनों ही जो है कोलाजन पे डिपेंडेंट है।
Nice. And when we've got that collagen in your skeleton, it kind of allows minerals like calcium and phosphorus to deposit on the framework to make the bone hard and strong. And when you've got collagen in your skin, it's actually also the main component of the dermis, which is the lower layer of skin that connects to the blood supply. And that acts and supports from elasticity to bounce. It helps with hyaluronic acid, so stimulates the lovely glow and the plumpness of your skin, hydration. So really it is everything for your skin and everything for your bone. And that's just little old measly collagen. Thank you.
Right. तो कोलाजन जो है आपके बोन्स में जितने भी मिनरल्स होते हैं उनके डिपोजिशन के लिए, उनके स्ट्रक्चर के लिए, फ्रेमवर्क के लिए बहुत इंपॉर्टेंट है। सिमिलरली जो स्किन है उसके जो डर्म है, सबसे नीचे वाली जो लेयर होती है उसका पार्ट होता है, और वो काइंड ऑफ वहाँ पे हियालुरोनिक एसिड भी होता है जो आपके स्किन को यूथफुल बनाता है। और ये जो है आपके स्किन के लिए और बोन्स के लिए, स्किन के लिए बेसिकली एवरीथिंग है, ये आपको स्किन को स्ट्रक्चर देता है, सिमिलरली फॉर बोन्स आल्सो।
And unfortunately, ladies, I love it when we see the thumbs up. Exactly. And unfortunately, as we get older, hormone sensitivity, number 2 on the list there, our estrogen depletes. Now, estrogen is a nutritive hormone. Estrogen is essential to support the collagen, to support the skin elasticity, to support hydration. So vital that we have the hormone sense or hormonal balance. But obviously that sensitivity comes into play as we get older. Things like testosterone, so that changes as we age as well, and that affects our sebum production, so the oil production in our skin. And then obviously as we moving through the menopausal phases, we have things like cortisol. Now cortisol elevates stress in the body, gets us out of bed in the morning, but cortisol is a stress hormone, and that can affect your skin, your bone integrity, the membrane integrity, so consequently causing inflammation. So understanding our hormones is vital, and helping us manage our hormones and support our stress is the key component of all things women's health training.
Right. सो जब मीनोपॉज में एस्ट्रोजन जो डिक्रीज करता है, एस्ट्रोजन जो है वो कोलाजन के इंटेग्रिटी, कोलाजन के लिए बहुत इंपॉर्टेंट है। जैसे जैसे एस्ट्रोजन डिप्लीट करता है मेनोपॉज में वैसे वैसे कोलैजन भी डिप्लीट करने लगता है, बोथ फ्रॉम बोन्स एंड फ्रॉम स्किन। और जो कोलैजन है वो आपके स्किन को इलास्टिसिटी देता है, यूथफुलनेस देता है। और इसीलिए बहुत जरूरी है कि हम हार्मोन के बैलेंस को जो है मेंटेन रखें। स्पेशली जब आप एज करते हैं तो कॉर्टिसोल हार्मोन भी आपकी बॉडी में इंक्रीज करता है, विच इज अ स्ट्रेस हार्मोन। जो स्ट्रेस हार्मोन है वो आपके बेसिकली सारे जो आपके स्ट्रेस लेवल्स को बढ़ाएगा। सो यहाँ पे हार्मोनल डिसबैलेंस बहुत ज्यादा हो जाता है इन मेनोपॉज। दैट इज व्हाई हमें हार्मोनल बैलेंस को सपोर्ट करना बहुत जरूरी है।
Fantastic. Okay, and so then the next one I know is very common, very well understood. Unless we've got a challenge in diet, invariably people are not deficient in calcium unless you live in a malnourished area. Calcium is not a challenge. However, what happens if people aren't eating enough as we age? Our skin becomes fragile and our bones become porous. So it's really important that our bones, important for bone mineralization to have that calcium component, but vitamin D as well. So what happens if we've got a healthy diet, we've got healthy gut microbiome, our healthy bacteria actually stimulates production of vitamin K. Now, vitamin K will shuttle the vitamin D to your bone cells and allow that calcium to be drawn in. But if we've got an unbalance in our body, we've got an unbalanced calcium level in and bone strength. So it's very important that we get our diets right. And deficiencies will affect women. And obviously, vitamin D is a very common deficiency. We've got 90% of the global population being deficient in vitamin D. So that is a very important component that we need to look at to support bone health as well as skin health, because low levels of vitamin D cause bone pain, low levels of vitamin D cause skin inflammation, poor skin replication, and kind of pigmentation within the skin. So, oh my gosh, micronutrients, calcium and vitamin D, skin, bone, vital.
Yes. So जनरली हमारे जो डाइट्स हैं वो कैल्शियम में उतनी कमी नहीं होती अनलेस एंड अनटिल बहुत ही ज्यादा माल नरिश्ड पॉपुलेशन हो। बट कैल्शियम होना इनफ नहीं है बॉडी में। विटामिन डी बहुत इंपॉर्टेंट होता है उसके अब्जॉर्प्शन के लिए। सो मेजरली जो है 90% पॉपुलेशन, ग्लोबल पॉपुलेशन भी विटामिन डी में डेफिशिएंट है। और गट माइक्रोबायोम जो होता है, जो हमारे हेल्दी बैक्टीरिया है, वो विटामिन के को प्रोड्यूस करता है। सो विटामिन के जो है आपके विटामिन डी को एक्टिवेट करता है और कैल्शियम जो है आपके बोन्स तक डिपॉजिट होता है। और विटामिन डी जो है आपके स्किन के अगर कमी होगी तो आपके स्किन के इन्फ्लेमेशन के लिए भी रिस्पॉन्सिबल है। जो पिगमेंटेशन होता है आपके स्किन में वो भी बहुत इंपॉर्टेंट है। सो ओवरऑल कैल्शियम, विटामिन डी जो है और विटामिन के जो है आपके बोथ बोन्स एंड स्किन के लिए इम्पोर्टेंट है। और जो है इसकी डेफिशिएंसी पे काम करना हमें जरूर चाहिए। थैंक यू।
Fabulous. Okay, and then last but not least on this list is inflammation and oxidative stress. So we've touched on that already. If we're low in vitamin D, we've got inflammation. If we have a hormone imbalance, that can result in inflammation and oxidative stress as well. But chronic inflammation and chronic oxidative stress are really kind of entwined with accelerated aging, both for your bone health and your skin health. So we need to work out, and we're going to touch on this, different areas that we can use to reduce our stress levels, work on our cortisol levels to help calm the cortisol melatonin axis so we sleep better, and that in turn will support inflammation. But then we've also got to look at making sure we've got a healthy, nutrient-dense diet that's anti-inflammatory. So we're eating foods that support health. We've got to look at hydration and sleep as well. Thank you.
राइट। तो विटामिन डी की डेफिशिएंसी या न्यूट्रिएंट डेफिशिएंसी या फिर हार्मोनल इम्बैलेंस से हमारी बॉडी में इन्फ्लेमेशन और ऑक्सीडेटिव स्ट्रेस बहुत बढ़ता है। तो हमें कोशिश करनी चाहिए कि हमारा जो है डेफिशिएंसी को हम पूरा रखें, हार्मोन को हम इन चेक रखें, कोर्टिसोल लेवल्स को हम कम रखें, स्ट्रेस को मैनेज करें ताकि हमारी बॉडी में ओवरऑल इन्फ्लेमेशन और ऑक्सीडेटिव स्ट्रेस जो है कम हो और हमारे स्किन, बोन्स को उतना इफेक्ट ना हो।
Fabulous. Okay, so let's start with estrogen. So as I said, estrogen is really a nutritive hormone. It is our silent defender. It boosts collagen production in the skin. So as we age, oh my gosh, we need this baby. But unfortunately, as we can see from that graph, our estrogen levels plummet, as do progesterone, as do collagen. I'll give you a number. So it says that women can lose up to 30% of their bone mass in the first 5 years of menopause. And unfortunately, from the age of 20, we lose, so in the first decade, so 20 to 30 years, we lose 2% collagen. From 30 to 40%, that increases up to 3% collagen in the decade. From 40 to 50, 5% collagen. Can you imagine? So our poor bodies are losing collagen every decade. And unfortunately, as it says there, with estrogen depleting in our menopausal years, that collagen production is going to plummet even more. And we've already established how vital collagen is for bones and skin. So we need to support our bodies. The risks incorporated as a result, especially as we age, for bones and skin health are vital. Sorry, I keep going. Go for it.
ओके सो एस्ट्रोजन जैसे आप इस ग्राफ में देख रहे हैं, जैसे जैसे एज बढ़ती है वैसे वैसे एस्ट्रोजन प्रोजेस्टेरॉन लेवल्स डिक्रीज कर रहे हैं, और इवन कोलैजन जो है वो डिक्रीज कर रहा है। और जो एस्ट्रोजन है वो कोलैजन प्रोडक्शन को बूस्ट करता है। सो जो फर्स्ट 5 इयर्स होते हैं मीनोपॉज के, उसमें एटलीस्ट 30% जो है एस्ट्रोजन डिप्लीट करता है। और कोलैजन भी जो है फर्स्ट जो डिकेड होता है 20 to 30, उसमें 2% डिक्रीज करता है 30 to 40 में, और 5%। एंड ग्रेजुअली जो है विद एज कोलैजन प्रोडक्शन भी डिक्रीज कर रहा है। जब एस्ट्रोजन इतना हेविली डाउन होगा तो ऑफ कोर्स कोलैजन प्रोडक्शन को भी इफेक्ट करेगा।
Okay, so let's have a look what that bone mass looks like. So when we're talking bone mass, it really refers to the mineralization bone tissue in the body, essentially the density and the strength. So the density, so how dense the bone is, it's not porous, it's got, good concentration of cells, and the strength of our bones. So you haven't been known to have any stress fractures over the course of your menopausal years. And what we can see here is in the early years of both female and male lives, bone mass increases notably. So we've got a lovely peak, but then as we continue through our age, unfortunately, that rate declines. But unfortunately, look at those numbers. So us ladies, our bone mass plummets as we move from around 45 years onwards. So we need to be considering our diets, our lifestyles continuously to ensure we've got that bone remodeling occurring all the time. Now, I'll talk about bone remodeling in a little bit.
ओके सो जब आप ये ग्राफ देख रहे हैं, ये मेन और विमेन के कंपैरिजन में आपको दिखाया है कि जैसे इनिशियल ईयर्स जो होते हैं उसमें दोनों के जो है बोन ग्रोथ जो है वो कंटिन्यूसली इंक्रीज कर रहा है। एंड अराउंड 30s अगर आप देखेंगे तो अराउंड 25-30 पीक बोन मास, जितना मैक्सिमम बोन मास है वो रीच हो रहा है। और ग्रेजुअली जो है आफ्टर 35-40 जो है बोन मास डिप्लीट कर रहा है। बट फीमेल में बिकॉज ऑफ मीनोपॉज ये बोन लॉस जो है वो बहुत ड्रास्टिक होता है एज कम्पेयर टू मेन। इसीलिए हमें डाइट और लाइफस्टाइल को जो है सपोर्ट करना, उसको मैनेज करना बहुत इम्पोर्टेंट है।
So in 1965, this correlation was actually established where they discovered people with osteoporosis. And I will show you what a picture of an osteoporotic bone looks like in a second. But people with osteoporosis had notably thin skin and regularly had kind of hairs in their skin or scrapes or would bleed easily. And so they realized there was a strong correlation between the two.
ओके सो 1965 में ये देखा गया था, ऑस्टियोपोरोसिस को एक्चुअली काइंड ऑफ डिस्कवर और स्टडी किया गया था। अगर ये देखा गया था कि जिनको ऑस्टियोपोरोसिस होता है उनकी स्किन भी बहुत थिन सेंसिटिव होती है, बहुत जल्दी उस पे ब्लीड कर जाती है, वेरी सेंसिटिव। तो तब ये समझा गया कि देयर इज अ कोरिलेशन ऑफ बोन एंड स्किन एंड कोलैजन।
Okay, so skin as a window to bone health. So that's the exact reason why I just told you that research study, because as you can see, there's that connection. So skin and bone share the common components, as we said, collagen, but they also share a similar pathology due to similar kind of modifications of how the collagen is kind of created. So the connective tissue, which collagen is, of skin and bones really readily breaks down at the same rate and kind of reduces in integrity as we get older. And as you can see here, studies have shown that skin wrinkling and decreased elasticity actually correlate with low bone density. So it's quite amazing. And so often people don't even think that there could be a connection. What we're saying is if there's a aging of your skin, if you've got wrinkles, fine lines, thin skin, breaking, bruising easily, we need to consider doing a bone scan because the density of your bone might be affected as well. And it's always worth knowing, always worth testing. If I can say anything, challenge every one of you, make sure you regularly have tests to ensure your bone health. Because if it's showing you aging, unfortunately we all do, but we need to protect our bones and our skeletal system, because if you understand what your bones are, what's happening with your bones, we are not going to be as fearful of things like spinal challenges, hip challenges, knee challenges, shoulder challenges, anything like that. It's really can impact on our livelihood going forward. Skin wrinkling is an early postmenopausal woman is significantly associated with bone density. Yeah.
Right. So skin as a window to bone health, मतलब अगर आपकी स्किन एज कर रही है, जो डेफिनेटली हम लोग सभी एज करते हैं, बट रिंकल्स, फाइन लाइंस, अगर आपकी स्किन बहुत जल्दी कट्स एंड ब्रूजेस, ब्लीडिंग हो जा रहा है, तो यू हैव टू, आपको अपनी बोन डेंसिटी को भी चेक कराना चाहिए, बिकॉज कोलाजन जो है वो एक ही, अगर कोलाजन का लॉस हो रहा है तो वो बोथ स्किन में भी हो रहा है और आपके बोन्स में भी हो रहा है। तो अर्ली अगर आप डिटेक्ट करते हैं, अगर अर्ली स्कैन कराते हैं आप बोन्स के और बोन डेंसिटी के, तो आप बहुत सारे जो इश्यूज हैं उसको प्रिवेंट कर सकते हैं, चाहे वो आपके शोल्डर इश्यूज हैं, बैक इश्यूज हैं, या फिर आपके कोई भी जॉइंट इश्यूज हैं, बोन इश्यूज हैं, उसको आप प्रिवेंट कर सकते हैं।
Brilliant. Okay, so let's look at the timeline. It really does kind of get worrying when you look at things like this, but I promise it's completely normal for the aging skin timeline. But obviously there's ways of supporting our bodies and supporting our health, because it's all about longevity. So as you can see, in your 40s and 50s, skin becomes thinner, it becomes drier, wrinkles deepen as we get older, bone reabsorption accelerates. By 60, skin may lose 30% of its collagen. Okay, so when we're talking bone reabsorption, we're talking bone remodeling. Now, bone remodeling is something that happens and how the integrity of our bone cells maintain their strength. Just like your skin, you know how you've heard the fact that you lose skin as you're walking around the house? Well, that's what we're going to talk about now. Sorry, go for it, Neha.
Yeah. ओके, सो एजिंग स्किन के टाइमलाइंस में ये जो स्लाइड है वो आपको बता रही है कि आप जब 40s और 50s में होते हैं तो आपकी स्किन जो है बहुत ही पतली होती जाती है, थिन होती जाती है, ड्राई होती जाती है, रिंकल्स आते जाते हैं, और बोन, साथ ही साथ आपका जो बोन रीजॉर्प्शन है, मतलब बोन का जो डेंसिटी है या बोन के जो रिजॉर्प्शन है उसका खत्म होना धीरे धीरे वो एक्सेलरेट हो जाता है, और बाय 60 आप अपने कोलेजन को ऑलमोस्ट 30% तक लूज कर सकते हैं। yes.
I got so scared by the aging skin timeline and I needed some water there. Okay, so this is when we spoke about osteoporosis, when your bone cells become porous. As we're aging, the aging skin timeline is connected with how your bones are being remodeling or not remodeling. What this is saying is the frame crumbles, the skeletal system can no longer remodel as well as it should. So the bone thins, the cortical bone thins, the trabecular bone becomes porous, and fragility is the result. Your bones become fragile, fractures increase, especially the spine, the hip, and the wrists as well. So often when older people fall, they put their hands down and it causes notable challenges with their wrists. Every year, 2 million fractures occur due to osteoporosis. in the US, more than heart attack, stroke, and breast cancer combined. So that is something very worrying. And if we were to understand what your bones are doing when we're young and healthy, it's something called bone remodeling. So little cells called osteoblasts, and you can remember this because they're blasting new bone growth all the time. So osteoblasts are creating new cells. Osteoclasts, they're climbing and clambering and taking away the dead bone cells. So they're constantly remodeling the bone cells, and that remodeling is what creates intensity and strength within your bone. Now, astronauts, when they fly out to space, they actually have to weigh themselves down on a treadmill to create impact so that that bone remodeling takes place. So impact exercise is very important, even if you're battling osteoporosis. But it can be simple things like walking. I'm not saying go jogging if you've got osteoporosis. I'm just saying gentle walking actually creates that impact that solidifies and creates that bone remodeling, and that's what we want.
जब आप एज करते हैं तो ये जो पिक्चर्स आप देख रहे हैं नॉर्मल बोन्स की, ऑस्टियोपेनिया जो कि एक इनिशियल स्टेज है ऑस्टियोपोरोसिस की, और ऑस्टियोपोरोसिस और सिवियर ऑस्टियोपोरोसिस, इसमें बहुत ज्यादा बोन पोरस होने लगती है, आपके मिनरल्स डिप्लीट करने लगते हैं, आपका फ्रेम जो है बहुत ही सेंसिटिव हो जाता है, जो स्केलेटल फ्रेम है। और बोन रीमॉडलिंग जो है, मतलब रीमॉडलिंग मतलब आपके बोन्स में दो टाइप के सेल्स होते हैं, ऑस्टियोब्लास्ट, ब्लास्ट मतलब ज्यादा ब्लास्ट हो रहे हैं, बन रहे हैं, एंड ऑस्टियोक्लास्ट मतलब जो आपके बोन्स को बेसिकली कम कर रहे हैं, बोन की जो फॉर्मेशन है वो कम हो रही है। सो विद एज जो ऑस्टियोक्लास्ट की एक्टिविटी है, जो बोन सेल्स को डिप्लीट कर रही है, वो बढ़ जाती है, और ऑस्टियोब्लास्ट जो है वो कम हो जाता है। तो ये रीमॉडलिंग कंटिन्यूस होती रहती है। और आपके जब जो एजेड लोग होते हैं, वो जब गिरते हैं तो ज्यादातर हाथ के बल, हाथ से वो रोकने की कोशिश करते हैं, तो उनके रिस्ट फ्रैक्चर्स, हिप फ्रैक्चर्स, स्पाइनल फ्रैक्चर्स बहुत ज्यादा बढ़ जाते हैं। जब एस्ट्रोनॉट्स जो होते हैं, वहां पे भी उनको जो है अपनी ये जो रीमॉडलिंग है, ऑस्टियोक्लास्ट की जो ऑस्टियोब्लास्ट की जो एक्टिविटी है उसको बढ़ाने के लिए उनको ट्रेडमिल पे भगाया जाता है, ताकि ये जो एक्टिविटी है ये ऑस्टियोब्लास्ट की एक्टिविटी को बढ़ा दे। तो इसीलिए जो है सिंपल वॉकिंग या एक्सरसाइज जो है बहुत मैंडेटरी होती है बोन रीमॉडलिंग के लिए। और इसमें ये भी डेबी ने बताया कि 2 मिलियन जो है फ्रैक्चर्स यूएस में होते हैं जस्ट बिकॉज ऑफ ऑस्टियोपोरोसिस, मोर देन हार्ट अटैक, स्ट्रोक या इवन कैंसर।
It's scary, isn't it? Okay, but now we have options, and things to consider could be going through an allopathic route, and this is where you can go for something called HRT, hormone replacement therapy. Now, this slide is quite direct. It says it's a double-edged sword because there are pros and cons with going for HRT options. It can improve skin thickness. It improves the hydration of your cells. It can reduce bone loss, and HRT can reduce fracture risk by 30 to 50%. So it substantially can be supportive of your health when we're moving through the menopausal years. HRT is generally recommended to be started when menopausal symptoms first impact your life, which really is prior or during perimenopause, before the end of your last period. Okay, so some people don't need HRT. However, some people do, even if they've gone through a medical event where they don't have menopausal symptoms, because HRT, especially for those who are suffering from osteoporosis, can definitely support bone remodeling and growth. So there are benefits to it, but it also comes with risks. As you can see there, blood clots, breast cancer, stroke, and it depends on the type, timing, and duration. So there are definite risks and there are definite benefits. And everyone who moves into this phase of life, this is an option. But then there are other options as well. And I think that's what I love. Oh, sorry, before I move on to the next options, go for it, Nia.
Okay. So हार्मोन रिप्लेसमेंट थेरेपी बेसिकली ये विमेन के लिए होती है जब वो फर्स्ट जो सिम्टम्स हिट करते हैं उनको मीनोपॉज के या फिर पेरीमेनोपॉज में। और ये जो एचआरटी थेरेपी है, इसके बेनिफिट्स भी हैं लेकिन इसके नेगेटिव भी हैं। तो बेनिफिट्स ये हैं कि स्किन की थिकनेस, हाइड्रेशन को इंक्रीज करती है, बोन लॉस को डिक्रीज करती है, इवन रिस्क फ्रैक्चर्स को 30 to 50% रिड्यूस करती है। बट साथ ही साथ इसके नेगेटिव्स भी हैं, जैसे कि ब्लड क्लॉट्स हो सकते हैं, ब्रेस्ट कैंसर, स्ट्रोक, डिपेंड्स कि जो थेरेपी आप ले रहे हैं कौन से टाइप की है, टाइम क्या है, ड्यूरेशन क्या है। सो इट्स लाइक बोथ एज स्वॉर्ड की तरह है, बेनिफिट्स भी हैं और इसके नेगेटिव्स भी हैं।
Nice. But when it comes to health and well-being, it's just like focusing on your well-being. Your health is imperative, and there are so many health and lifestyle factors that we can factor into our day-to-day that account for 80% of your health outcomes rather than standalone kind of genetics or medical scenarios. So that is why we also look at alternatives. So we have things like HRT or bioidentical hormones. Now, they are using hormones, but chemically altered to support the body when they have such a reduced amount of hormones in the body, specifically estrogen, progesterone. Obviously, the risks and side effects, like we just spoke about, blood clots, heart disease, cramps, digestive issues. And really, they really do support for some, not all. But when we're talking about alternatives, there are so many areas that we can support the body and support your needs. These can be things like lifestyle changes, complementary therapies, alternative medicine, and that can range anywhere from exercise, breathing techniques, diet, herbs, sleep techniques, kind of finding gratitude, looking to specific foods that trigger inflammation in the body, looking to eliminate certain foods that cause kind of a response or a negative reaction in the body, things that interact with kind of challenges you have in your day to day. And I'm going to touch on each of those. Go for it, Nika.
So HRT के अलावा भी बहुत सारे ऑप्शंस हैं जो हम, बिकॉज HRT के बहुत प्रोज एंड कॉन्स हैं, तो इसके अलावा भी ऐसे बायो आइडेंटिकल हॉर्मोन्स हैं जो प्लांट बेस्ड होते हैं, जो मिमिक करते हैं, जो रेप्लिकेट करते हैं बेसिकली उनके बेनिफिट्स को। एस्ट्रोजन, प्रोजेस्टेरॉन और टेस्टेरॉन के जैसे हॉर्मोन्स होते हैं, बट दे आर प्लांट बेस्ड। और जो है वो काफी, ये जो है बहुत सारे सिम्टम्स जो है मीनोपॉज के लिए बेनिफिशियल हैं, कि सिम्टम्स को रिड्यूस करते हैं, उसमें हेल्पफुल होते हैं। इनके रिस्क और साइड इफेक्ट्स भी कभी कभी होते हैं कि समटाइम्स जो ब्लड क्लॉट्स, हार्ट डिजीज, क्रैम्प्स, बट कुछ को डेफिनेटली बहुत अच्छे से सूट करते हैं, कुछ को नहीं भी कर सकते हैं। बट इसके अलावा भी हमारे पास ऑप्शंस हैं, ऑल्टरनेटिव्स हैं, जैसे कि लाइफस्टाइल चेंजेस, कॉम्प्लीमेंट्री थेरेपीज लाइक स्लीप थेरेपीज, स्ट्रेस रिडक्शन, मेडिटेशन, या फिर आप वॉक, एक्सरसाइज, होलिस्टिक अप्रोच, डाइट, लाइफस्टाइल। तो बहुत सारे ऑप्शंस हैं टू मैनेज दिस।
Okay, so this chart shows you the stages of menopause. And what I found interesting is, so just move that, is they've got the alternatives included in it. But I want to challenge this chart, because as much as they are completely right, we should be incorporating all of those components within that stage of perimenopause. We should actually be doing all of these components from day one. Okay, sure, maybe not a 5-year-old child thinking about lifestyle changes and things like that, but we should be instilling those sort of values in ourselves, in our children, in our family, in our friends. Things like, waking up each day and finding gratitude in the sunrise, finding awe in the view, because that stimulates happy hormones, that stimulates feelings of happiness, endorphin rushes, which stimulates oxygen to the brain, oxygen to the cells. It dumps a load of nutrients in each of your cells just by being grateful. I know we never even think about that. I know, how often people say, oh, you should write a gratitude journal. And the amount of times I've gone, really? I'm talking about physical and psychological health. I'm talking about clinical medicine. But really, gratitude stimulates health by encouraging endorphins, happy hormones, serotonin, mood support hormones. It also oxytocin, so feel-good hormones. All of those three stimulate health by encouraging the reduction of cortisol in the body that reduces stress, that encourages the body to utilize the nutrients. It improves the gut microbiome, which is all about, health and well-being. It's your immunity center of the body that then in turn creates a healthy, glowing skin, healthy, vibrant lifestyle. Can you see how it's all interconnected by little lifestyle changes that we disregard as being important when they so incredibly are? And that includes things like diet and sleep and all of that sort of thing.
Right. तो ये जो आप देखेंगे स्टेजेस ऑफ मीनोपॉज दिखा रहा है, और इसमें जो ऑल्टरनेटिव्स हैं, जो लाइफस्टाइल चेंजेस दिखा रहे हैं, वो पेरी मीनोपॉज में है, बट डेबी कहती है शी डजंट अग्री, बिकॉज ये जो चेंजेस हैं, लाइफस्टाइल चेंजेस, हेल्दी डाइट, जब आप सुबह उठते हैं, सन को ग्रैटिट्यूड में बहुत ज्यादा पावर होती है। ये बहुत ही अर्ली स्टेजेस से ही हमको अडॉप्ट करना चाहिए अपने बच्चों में, अपनी फैमिलीज में। जब आप ग्रैटिट्यूड लेते हैं, जब आप करते हैं, जब आप हैप्पी रहते हैं, तो ये आपके जो हैप्पी हार्मोन्स हैं, एंडोर्फिन्स है, सीरोटोनिन है, इनको स्टिमुलेट करता है ग्रैटिट्यूड होना, लाइफस्टाइल में चेंजेस करना। और ये जो हार्मोन्स है, ये आपके कोर्टिसोल लेवल्स को कम करते हैं, आपके हैप्पी हार्मोन्स को बढ़ाते हैं। साथ ही साथ ये जो आपके गट माइक्रोबायोम को भी अच्छा रखते हैं, एंड इन टर्न आपकी बोन्स, आपकी स्किन। सो देयर इज अ वंडरफुल रिलेशनशिप, लाइफस्टाइल, ग्रैटिट्यूड, इन सब का जो रिलेशनशिप है, ये इंटर रिलेटेड है। सो वी शुड प्रैक्टिस एज सून एज पॉसिबल। हमको अपनी फैमिलीज में ही इसको इनबिल्ट करना चाहिए।
Fabulous. And apologies if I sound a little bit static. My connection just told me I was unstable. But I'll keep going. Is it all okay? Can you hear me okay?
Yes.
Okay. Okay. So with that in mind, these are some holistic solutions for radiant skin and resilient bones. So we just spoke about from the social context, things that stimulate and encourage time with others. Social is vital. Financial health is a great way to ensure our cortisol levels don't climb. And that's why you've got the brilliance of working with and for USANA. But there's always other ways to support your financial needs. So obviously, focusing on growing your USANA business, focusing on supporting your financial needs from a health standpoint and a wellness standpoint. And obviously, when you find your health, you're not having to spend a large amount on your medical standpoint going forward in the future. Spiritual, whatever your spiritual is, that helps you find that gratitude as well. Occupational, we need occupational wellness. So you need to be well enough, healthy enough to sustain for your job, but you've also got to be stimulated by your job. Find excitement in what you do every single day. And that's, I think, the brilliance of all things USANA. When you're a product of the product, you're using something that supports your health and well-being, that supports your family, and then that's what you share with others. It's an incredible opportunity to really develop your understanding of life and what the opportunities are. Emotional, be connected with who you are, be connected with kind of your environment. In New Zealand, we've got something called Tūranga Waiwai, which is all about knowing who you are, be kind of connected to your family, your friends, your land, and know where you're going, your future, your aspirations, your goals. Intellectual, grow yourself. There's never enough time to really understand everything you can be. So spend every day learning one new thing. I challenge every one of you to learn one new thing. Challenge yourself, better yourself, grow yourself, use a new word, think of a new idea, encourage your family and your friends to do the same. And then obviously environmental. Our world is so small. Our planet is obviously not what it used to be. Do one thing to clean it up a little bit, whether it's, pick rubbish up off the street or buy a coffee for a friend or give someone a hug. That develops that happy hormone. It's all about oxytocin and makes their day better, or smile at someone in the shop or make their job easier. And last but not least, and I know I left this one to last, but this is my all-time favorite, physical exercise. Oh my gosh, you need it. You must include it. Everyone should be incorporating some form of exercise, whether it be 10 minutes every hour, or going for a nice walk around the block, getting some sunshine, swimming, going to the gym, riding a bike, whatever it might be. We need to increase our heart rate. We need to increase blood flow to each of our cells. We need to make sure that we're strengthening our muscles, because ladies, as we get older, our bones become fragile because our muscles are weakening. We haven't got the same amount of strength that we had 20 years ago. We haven't got the same protein in our diet that we should do. So whatever your body weight, you need to times that by 1.2 grams per kilogram of body weight. That's how much protein you should be having per day. If you're not getting that, you need to increase it. You can even have more than that. So we need to focus on what we're doing to ensure health. And I think this is the most brilliant way of describing that. Sorry, that was a lot.
Yeah. No, wonderful, Debbie. So Debbie कह रहे हैं कि holistic solutions जो हैं हमें अपने skin, radiant skin और resilient bones के लिए लेने जरूरी हैं. First is of course financial stability. जब आप यूसाना business के साथ grow करेंगे, of course financial stability जो है आपको stress reduction में definitely काम करती है, सबको पता है. Second, spiritual जो है, जो भी आप स्पिरिचुअल अपने जो बीइंग्स हैं वो आप अपने स्पिरिचुअल उसको आप जरूर फॉलो करें. दैट रिड्यूसेस स्ट्रेस एंड कॉर्टिसोल हार्मोन्स. ऑक्यूपेशनल, यू हैव टू बी हेल्दी इफ यू वांट टू आप अपनी जॉब या अपना बिजनेस जो भी आप कर रहे हैं उसके लिए यू हैव टू बी वेरी हेल्दी, राइट. इमोशनल, आप अपनी फैमिली से अपने इमोशंस, अपनी फैमिली, अपने जहां आप रह रहे हैं इमोशंस से कनेक्टेड रहना, अपनी फैमिली से कनेक्टेड रहना बहुत जरूरी है, जो आपके स्ट्रेस बस्टर है, आपकी फैमिली, आपकी वेलनेस. इंटेलेक्चुअल, आपके आप एवरी डे कुछ ना कुछ नया जरूर सीखने की कोशिश करें. आपका माइंड जो है वो वर्क करता रहना चाहिए. अपने आप को चैलेंज करें, अपने आप को जितना ज्यादा सीख सकते हैं उतना सीखिए. इन्वायरमेंट के लिए काम करिए, बिकॉज चाहे तो आप रबिश जो कूड़ा है उसको आप साफ करने की अपनी सोसाइटी में या किसी के साथ एक कॉफी या मे बी आप किसी को डोनेट कर सकते हैं, या आप एक सिंपल हग जो है वो आपके इमोशंस को बैलेंस करने में हेल्प करता है. हैप्पी हार्मोन्स एंड फिजिकल, डेफिनेटली आपको डेली जो है कुछ ना कुछ एक्सरसाइज, वॉक है या स्ट्रेंथ ट्रेनिंग है. जैसे जैसे विमेन एज करती हैं उनकी जो बोन डेंसिटी है वो कम होती है, मसल लॉस होता है, जिसमें स्ट्रेंथ ट्रेनिंग या फिजिकल एक्टिविटी बहुत इंपॉर्टेंट है. तो ये होलिस्टिक अप्रोच लेना, डेबी कह रहे हैं, दैट इज वेरी वेरी इंपॉर्टेंट फॉर ओवरऑल वेलबींग, चाहे वो इमोशनल है चाहे वो फिजिकल वेलबींग है.
Okay, so top tips. As I said, nutrition and diet, vital. Weight bearing exercises. So that's just another way of saying resistance training, exercise using all of your muscle groups. So if you don't go to a gym, you can do squats, you can do press ups, you can do chin ups, you can do lunges, you can do wall sits, you can sit ups. All of those incorporate your large muscle groups. They're called compound exercises. And what that does is it pulls on the bones and creates strong bones, rigid cells. It also encourages your muscle strength, so that supports circulation throughout the body. So weight-bearing exercises, very important. But you also need to remember that your heart is a muscle. So we do need to use exercise that increases our heart rate and makes us short of breath, because that will stimulate that environment that encourages you to push a little more, encourage oxygen and nutrient flow to your cells. And that's where it comes from, resistance training and weight-bearing exercises. Eat anti-inflammatory, nutrient-rich diet. So I might have said this before, I challenge everyone here today to eat 40 different foods a week going forward. And I know that's challenging for some, especially if you eat like toast for breakfast and sandwich for lunch and, I don't know, something like that for dinner. We need to expand our palate. And that includes me, because I sometimes challenge on that front. We need to expand how much we eat seeds and legumes and nuts, a variety of green leafies, a variety of colors. Make sure we're getting our proteins, whether it's vegetable proteins or animal proteins. Make sure you're getting your calcium and your magnesium in your diet, because unfortunately we are low in our magnesium levels. And when we have an abundance of calcium, that's impacting on our magnesium. and omega-3s as well. We need to ensure we've got sufficient micronutrients and omega-3s to support our cognition, to support our circulation, to support our recovery. So there's so many components in our diet that we need to include that, unfortunately, with nutrient depleted soils, with us eating foods that are hydrolyzed, pasteurized, having a wide range of chemicals, are impacting on our health. For those of you who didn't realize, we are 85% depleted in omega-3. So omega-3 is in all of our cooking oils. Unfortunately, what they're doing with our cooking oils these days is heating them up and cooling them down, and heating them up and cooling them down so that they don't go rancid, so that they can manage a higher cooking temperature, so which is beneficial, right? But unfortunately, it's destroying the quality of the cooking oil, and that's impacting on our bodies. So our omega-3s are depleted. We need to supplement with an omega-3. We need to supplement with calcium. We need a generalized multivitamin, because unfortunately, our bodies are depleted and we're eating ourselves hungry. So there's this statistic that shows in the US, someone who lived in 1950 and ate an orange, they would need to eat 8 oranges today to match the vitamin C quantity in 1950. How scary is that? So we ourselves hungry.
So ये टॉप टिप्स हैं। डेबी कह रहे हैं कि न्यूट्रिशन और डाइट को हमें हमेशा से अच्छा रखना, बैलेंस रखना बहुत जरूरी है। वेट बेयरिंग एक्सरसाइजेस, चाहे आप वेट या रेजिस्टेंस एक्सरसाइजेस जरूर करें, चाहे वो स्क्वाट्स हैं, लंजेस हैं, चिन अप्स हैं, कोई ना कोई। अगर आप जिम नहीं जा रहे हैं तो ट्राई टू डू दीज एक्सरसाइजेस, आप अपने घर में ही करें। और बट रेगुलर करें, उससे आपके बोन में जो है बोन लॉस जो है वो डिक्रीज हो सकता है, मसल लॉस बढ़ सकता है। और दूसरा, ब्लड सर्कुलेशन जो है आपकी पूरी बॉडी में बेटर होगा। और एंटी इंफ्लेमेटरी न्यूट्रिएंट रिच डाइट जो है वो बहुत जरूरी है। उन्होंने आपको एक चैलेंज दिया है कि आप एटलीस्ट 40 डिफरेंट फूड्स एक वीक में जरूर लें। ट्राई टू इनकॉर्पोरेट मल्टीपल, जैसे बहुत सारी ग्रीन लीफी वेजिटेबल्स हैं, सीरियल्स आपके अनाज हैं, मिलेट्स हैं, फ्रूट्स, वेजिटेबल्स, नट्स, डिफरेंट टाइप के जो है फूड्स आप अपनी डाइट में इंक्लूड करें। और जो है माइक्रो न्यूट्रिएंट सप्लीमेंटेशन, जो है कैल्शियम बहुत है लेकिन मैग्नीशियम जो है वो डिप्लीट कर रहा है हमारी बॉडीज में। तो सप्लीमेंटेशन जो है वो बहुत जरूरी है ओवरऑल आपके हेल्थ के लिए। और उन्होंने एक एग्जाम्पल भी दिया है कि ये सप्लीमेंट्स की हमें क्यों जरूरत पड़ती है, क्योंकि सॉइल क्वालिटी जो है वो ग्रेजुअली बहुत ज्यादा डिप्लीट कर चुकी है। बहुत सारे केमिकल्स जो है हम इंटेक कर रहे हैं, बहुत सारे फूड जो है वो प्रोसेस्ड है। और जो 1950 में अगर किसी को एक ऑरेंज खाने की जरूरत होती थी टू गेट दैट, जो उतना विटामिन सी लेने के लिए, आज के टाइम में उसको 8 ऑरेंजेस खाने पड़ेंगे सेम अमाउंट ऑफ विटामिन सी लेने के लिए, जो एक ऑरेंज में पहले मिलता था। सो आप इमेजिन कर सकते हैं, इस बहुत ही फियरफुल सिचुएशन है, बहुत ही ड्रास्टिक चेंज हो चुका है हमारी सॉइल क्वालिटी में। सो दैट इज वाई ये सारे फैक्टर्स आपको माइंड में रखने हैं टू लीड अ हेल्दी लाइफस्टाइल।
Perfect. Well done. Okay, so that really wraps it up. How this connection is valid, why the connection is valid, and what we can do to make a difference. So we went through, what the hormone bone skin axis is, that correlation of those 3 components: estrogen, bone mass, and collagen. And then obviously how that impacts and can cause osteoporosis if we're depleted and deficient as our estrogen levels go down, and what our options are. So from what I've told you today and what we've been through, I challenge you all to focus on your diets. I challenge you all to incorporate exercise, focus on what you're doing day in and day out so that you reduce your stress, because that is entirely a hormone that we can manage. And it is entirely a hormone that can either be beneficial or detrimental, especially as we go through menopause. And good time for questions. Over to you, Nika.
तो आप क्वेश्चंस पूछ सकते हैं डेबी से। क्वेश्चन जी, हम यूसाना ग्रुप पे ये वीडियो, ये जो रिकॉर्डिंग है, हम लोग शेयर करेंगे. सो पीपल आर आस्किंग टू शेयर दिस रिकॉर्डिंग ऑफ द सेशन इन द ग्रुप सो दैट दे कैन go through it multiple times and understand it better. So we
Fabulous.
will
Well,
definitely
if
share.
any more questions, if you have any questions or anything after sharing the recording, I'm always happy to support. So, but it's been lots of fun being here with you all.
तो डेबी कह रहे हैं कि इवन रिकॉर्डिंग के बाद अगर आपके पास कोई क्वेश्चंस होंगे तो वो आंसर करने के लिए शी इज मोर देन हैप्पी. तो अभी तो और कोई क्वेश्चंस? सो डेबी, वी आर नॉट गेटिंग एनी अदर questions. They are also asking if it's possible to share the PPT.
Yes, of course. I'll send it through to you, Neha, and then you can adapt if
Sure.
need be for market, and then yeah. No, but and if for anyone who wants more detail around supplementation, obviously micronutrients is vital, as we keep talking to. Neha's your lady, she's the expert in the market, and yeah. But I'm here to support, so anything, don't hesitate to ask.
They are thank you so much, Debbie. I think it was a wonderful explanation, and the kind of statistics you have shared and the kind of, the information that you have shared is really wonderful, and it's like, an eye opener for us that we should actually work well before we actually land up in that situation. Thanks
Yeah.
a lot for this wonderful session, and um, okay. Thank you so much. I thought somebody is asking questions, but they are all praising your sessions. Wonderful session. Thanks a lot.
It's absolutely my pleasure. Thank you so much, and I will be seeing you again soon, I'm sure.
Yes,
Take care.
sure.
Thank you so much.
Thank you.
Have a wonderful day.
Wonderful
Bye.
day. Thank you so much.